Welcome back to complete our discussion talking about social determinants in health and adverse childhood experiences. Joining me again is Dr. Robert Block, chairperson of the University of Oklahoma School of Community Medicine's Department of Pediatrics.
Right.
I said it a little bit different this time. That brain is working, doctor. Let's jump in. Now, I want to focus on this segment looking at children once they're getting into the higher grades. They're getting older. What do we need to look at with schools? Because sometimes schools in general, when kids are not performing or there are discipline problems, we of course look at the child in terms of what they should do or not do, or they're old enough to know better, they're this, and then we may look at the parent in terms of they're not at home, they're not giving any kind of discipline to the child, they don't value education, they, them, and those people, what they don't do. Based on what you're saying, what should we begin to sort of refocus on?
Wow. The first thing to refocus is to take that finger that points at other people and sort of do away with it, because it's way too easy to just blame the child or the family and all the things that you just listed as the reason that we're having these problems, rather than looking beyond that. Quite often the problem does lie within the family. It doesn't mean that somebody was bad on purpose, it just means that there was, and there can be an underemphasis on the importance of education. There can be misunderstandings in terms of discipline and approaches to keeping kids focused on what they're doing and stimulated. But what we need to understand is that children in natural families, certainly children now in families where there's been changes, divorce and custody issues and remarriages, children living in foster families, children living with grandparents, which is becoming more common, have a reason to be living in those kinds of environments, none of which are bad. The environments are okay. But what happened in their lives to make things happen the way they did around the child and in the child's environment? And we need to say, is what we're seeing in this child a reaction to early childhood adverse experiences? Is this a reaction to something going on in the child's house or neighborhood now? Once took care of a child who had great difficulties in school, and it turned out that the reason was that every time he went to school and every time he came home from school, he was getting beaten up by a playground gang. So instead of focusing on reading, writing, and arithmetic, he was focused on how can I get a better escape route home. And once that was discovered, and the family took some actions to get him more safely to and from school, turned out to be a great kid who really enjoyed school and did very well. So we have to open our minds up to the fact that children today are nowhere near as alike to one another as they used to be, you know, in the good old days.
Right.
And I'm not even sure it was true then. But because we now know that what happens to children early in life affects the way their brain develops and the way their brain reacts, if we give that some thought, rather than just turning to the boot camps or turning to alternative schools or turning to suspension, which I know TPS is trying very hard to avoid whenever possible. Instead of doing that, we can start saying there's got to be a reason for this child to have to be having this difficulty. And yes, sometimes it is personality conflict between the child and the teacher. Not that the child's bad, and certainly not that the teacher's bad. They just are not a good fit. And goodness of fit is a very important thing, particularly for a brain that has developed so that it doesn't have a wide range of good fits and may need some very specific narrow fits in order for it to be successful.
Now, in this kind of approach, therefore, should schools be looking at, I'm trying to sort of help us understand how we could get to this. Is it where schools would look at doing some personality testing of students and personality testing of teachers and others that are working closely with them? And there is some research and literature out there in terms of personality types and what meshes with what and all that kind of thing. I mean, should we be looking at some educational sort of individualizing educational programs, not for special ed purposes, but for regular ed purposes in terms of tailoring how we deliver certain kinds of lessons because of where kids are in that brain development? I mean, what do we do?
I wish I could just say yes, but I think we know, and the viewers will know too, that we don't have a system that has enough person power, certainly doesn't have enough money to do all that kind of stuff, to really individualize an education. Fortunately, the majority of kids still fit a pretty similar mold. So what we need to learn how to do is identify as early as possible the child who has difficulties either with an academic subject, so we can study learning disabilities and find new ways to teach them, or a child who has a behavioral issue, so we can get some counseling that relates school to home, to the child, to the counseling. Then we can, I think, make a difference. There are personality profiles. There are some studies of mood and behavior that can be administered to entire student bodies that help us, for example, in specific situations. One that comes to mind is a study, an inventory that students can all be asked to take that shows what proportion of your students are significantly depressed. The findings, by the way, are pretty scary. There's a lot of depression in middle school kids, for example. Knowing that, not necessarily knowing it's this child or that child, but knowing that this is an issue in our school, then perhaps there's a way to introduce depression into the curriculum and read about depression, and before you know it, you're actually learning how to read, or talk about depression, or write a paper about depression. Not quite sure how to get mathematics in there, but you know, we have way too much to be able to teach in a very short school year. But I think we can find ways to mix and match things so that we can say to the kids, we understand that you guys are under a lot of stress.
Okay.
Let's talk about that stress, but let's do it in a way that'll help you. Maybe history. How did people deal with stress in history?
Right, and still get the academics in the same way.
So we have to have a little bit of flexibility in the curriculum, and people like myself who are not public educators, I still have a hard time understanding some of the constraints that public education is under in terms of testing and competency and that kind of thing, when we've got children who could be greatly helped to do better down the line if we had the ability to sort of put them into, give them some special consideration along the way, at least behaviorally, maybe even after school or before school, without having to change the curriculum. It takes a lot of spirit to do that, but we can do it.
Right. And let me ask this one quick question here in my last minute here. What about children who don't have health care providers? I mean, many times if you have the ability to go to the doctor, to see your pediatrician, you have that assistance either because you have insurance or can afford to pay for that, then you can get some input from the doctor in terms of what could be happening in that. But what about children who don't have that? How can we get them sort of that medical attention to begin to assist with some of the understanding in the way that you're saying? I've got like 15-second answer here.
Well, until we get national health insurance for all children, which is, of course, the only way to go, and we're the only civilized country that doesn't do that. Until we get that, there are resources for children, and the medical school clinics will take care of Medicaid. They'll take care of patients who don't have insurance. Don't stay home and not seek care because you don't have insurance or you feel you're too poor. Call the helplines, find out where to go. We'll get you taken care of.
Thank you so much, Dr. Block.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, suggestions, questions about future shows. And please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalert@gmail.com and visit me on YouTube at youtube.com/Health Alert USA. Take care, and remember, check out your resources because there are some available. Even if you don't think you can afford them, you'll be surprised when help is truly there. Take care. This program would not be possible without the support of OU Physicians in Tulsa.